This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, what's that old saying? Better late than never? Well,
John, there's nothing like technical glitches,
that's
but
right.
we're on.
Technical difficulties, but we're here and we're on.
I think it's all about this coronavirus.
Right. The
I
virus
really
has
do.
infected the technical aspect of the show.
Oh, my goodness.
All right?
Am I glad to be here. All right, John.
Good to have you with us. Health Watch every Sunday morning, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here to discuss a variety of issues, all of it designed to help you and your family improve your quality of life. And that's our mission statement, which we tell you every week here on the show. 855-839-1210 is our number here in the studio. If you have questions for Dr. Molly at any time during the course of the show, feel free to jump in and ask a question. What we're talking about here today is, like I said, a variety of issues. What they do at Innovative Medical Associates, how they do it, why they do it, when they do it, all of that kind of stuff. With the who, what, when, where, and why, as we say. And again, 855-839-1210 is our number here in the studio. Everybody's talking, Dr. Molly, about the coronavirus and
too much.
Exactly. I
Right?
mean, we're having protests now.
Honestly,
people tired of all this.
I know. And you know what, John? I'm sure there's a little bit of the fear factor is really, as we talk about week to week, the fear factor. But you know how I feel. Look, we've got to do things from a scientific point of view. I get that. And I would say that, you know, people who have chronic conditions, lots of my patients have chronic conditions and they need to be seen, which is why Dr. Molly has our staff masked up, and also we've cleaned up to the point of we're so sterile, I'm not sure we're like a surgical center at this point. And, you know, it's a good thing because we're there to help people improve their quality of life. And I think pandemic or not, we're going to be there, John.
So everyone, when they come in, you are open, by the way.
Absolutely.
You are open just as usual.
Again, chronic conditions.
Chronic conditions. So people do need your services.
Absolutely.
Myself included.
Right.
And so you're open and you get your temperature taken when you walk in.
At the door.
You got to wear a mask.
You got to wear a mask. And then, of course, we're going to follow through with everything else. You're completely put into a sterile environment, meaning the chairs are wiped down before, after, and in between. And every other day I'm having the entire facility sprayed with an antiviral. Probably so much so, I'm probably going to need new chairs at the end of this, which is okay. It'll be fine. Anything for our patients. But honestly, John, one of the things I saw yesterday, which really blew me away, is that physicians all across the country, at facilities like mine all across the country, are talking about folks who have chronic conditions and not being seen. Because believe it or not, there are people who are not technically savvy and can't do the telemedicine thing. What are they doing? I mean, come on.
Yes.
You know, some older folks who can't do it, or younger folks who can't, who knows? Or they don't have the facilities to have a teleconference. The good news is, in our facility, we are able to have a go-to-meeting should we want to conference into any of the specialists, and in particular to our consulting oncologist. But frankly, it's been really a tough road, and I really applaud my patients who have been tenacious in getting in and keeping their treatments up.
And what can happen? Talk about, because you were saying about some doctors aren't seeing patients, and
they're doing telemedicine.
They're doing telemedicine. Talk about what you're seeing in terms of, like, your patients are continuing to go, myself included.
Right.
I mean,
well, my cancer supportive patients will not miss.
Right.
And, you know, I'm thankful for that, because it really, in keeping their reserve and getting in the nutrients that we believe helps their quality of life through cancer treatments, we want them to feel good at the, you know, we fight the virus, but, you know, we're not helping our people with chronic conditions. Come on, you know.
What I was getting at was, if you miss, and let's say, you know, because of the virus and people don't come in, I mean, that could be a bigger problem in the long run.
Well,
right?
I think it certainly will impede their quality of life. And that's what we don't want to do, because in a case like this, what do you want? You want the strongest immune system you have available, because you're already fighting on one front. Right? I mean,
Right.
honestly, it's pretty common sense oriented. Now, I'm not telling you to go run out and go to a movie theater and that kind of thing, which is, we just got, look, what happened? My old friend, my old patient, and you know who that was. He was the most wonderful guy in the world. He would say, "Where is the common sense?"
Yes.
Where is the common sense? And everybody who's listening, who's old favorites, who really listened to me before and listened to him many times, he would say the common sense is what should be ruling your mind right now, because you got to continue to keep your health up and in tune.
That's exactly right, and that's what my concern was, is
Of
that
course.
this whole thing now is taking the focus off
Right.
a problem that you may have had, and
Right.
it's not going to go away because of a
No.
coronavirus.
No, and as a matter of fact, John, first of all, I guess we ought to tell people what hydration does, right?
Yes,
I mean,
yes.
we are a primary care facility, so we can do anything that any other primary care facility can. If you need an antiviral, we can prescribe it. If you need an antibiotic, we can prescribe it. My wonderful medical director and medical staff can do whatever they deem medically necessary. But what we try to do is use the least amount of pharmaceuticals and augment that with the nutraceuticals or natural substances that may help you improve your quality of life and diminish the side effects of the medication.
And all of this is done through hydration.
That's it.
Right.
You said it.
Right.
And that's really the crux of what we do. So that being said, it's interesting. I got a brand new patient who came to me. He was just recently diagnosed with a stomach cancer, I believe. He's not quite sure yet. He's finishing up a round of tests, etc. He went to a good friend of the clinic who is a nutritionist who sent him to me and said, "You've got to see him, Dr. Molly, right away." And of course we did. We saw him the same day he saw the nutritionist. And we laid out a game plan. We're not discouraging him from going and getting a second opinion. And also, we're not discouraging him from traditional treatment. This is something I want to put out here. What we want to do is augment his traditional treatment with some of the things that will help improve his quality of life while going through this. Because when he came in, he sort of felt hopeless. And I think that's a bad thing, especially when people are so depressed right now.
I think I met him. He's a
Yeah,
young guy.
real nice
young
guy.
right?
Real nice guy. And so, these conditions, these things like cancer supportive therapies don't stop. And he's starting with us on Tuesday because he's going for a scoping on Monday. I find it very interesting. They did get him in for a scoping, but I've been told by other cancer patients that if they're further along in their treatment protocol, the hospitals will take them to their treatment protocol, but they're not really rushing people in to get newly confirmed cases if it's not quote unquote serious in the moment. They're telling them we'll put you further down the road because you don't need to come in right this moment, which, by the way, fits right into what I say. You don't get cancer yet. You don't get diagnosed with cancer yesterday and you immediately have the disease. You've had this for a very long time.
You just didn't know about it. Yeah.
A couple of days here or there isn't going to make a difference.
Right, exactly.
Right.
I wanted to ask you, because the key to the hydration, at least for me, is boosting my immune system.
Right. In your case,
and-
that's exactly what we want to do.
And so, in a case of coronavirus where you need a strong immune system,
That would be
this
helpful.
can be very helpful.
Well,
right?
yeah. You know what's interesting, John? If we're talking about coronavirus, what are they talking about? They're talking about possibly using the plasma from people who've gone through coronavirus because why? They have the antibodies built up to fight the virus. So, it could very well be that, boosting up your immune system, I know, for example, it will help you get through a lot of other viruses, and there are many more. SARS is one of them. We had patients with SARS. We had patients with that terrible influenza a few years back. But, they tended to do better because they were regulars at our facility.
With hydration, and for any particular case,
Sure.
what are you talking about in terms of treatments? Are you talking 10, 15, 20?
Listen, we're talking about, in terms of the cancer supportive treatment, I tell them right up, we actually try to put a course of protocol into 10 treatments. And the reason why we use the number 10, it's because I'm able to get baselines and then follow up with certain parameters. Because again, I'm looking for data. I'm a scientist. I want to give data to my medical people because then they can help me guide a patient through. So, but when we're looking at someone, we probably are going to need 15 weeks, maybe at twice a week. So,
and that's in certain cases, but there's other cases where, like somebody like myself, have been coming for 20 years.
Well, you know what, John, because you're missing it. And you know what else? Here's the thing. You know what I like to say? I say this is Cheers without the booze.
There you go.
Because people really enjoy coming. Because why? Stimulate your mind.
Absolutely.
Stimulate your mind.
Well, you remember the time I was on vacation and I missed.
Oh, yeah.
And remember I said to you, I feel a little different.
Well,
and
your reserve went down.
And it was like 2 weeks between treatments.
But the reason being, it isn't that I want to go steady with you. You have several chronic conditions.
Yes.
Anybody else wouldn't be as robust as you are right now.
Right.
Okay?
Yeah,
So
I got a few challenges. Yeah.
Oh, yeah.
We are coming up on our first break of the morning, and we understand that we may go a little longer than 9 o'clock this morning. So stick with us. Health Watch is the show. Every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here, 855-839-1210. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. As always, operators are standing by at Innovative Medical Associates when we are on the radio. And you can call right now if you want more information or you want to make an appointment to sit down with Dr. Molly. The number is 856-489-0505. I'll say it again, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And we have good news. How about a round of applause?
Yes.
The website is up. Huh?
It's not fully together, but it's
there.
up, and
okay?
it shows that we really do have a clinic, and I would like folks to just check in on that. But remember, we're upgrading. We're going to have new photos, and this is sort of a skeleton to what we do.
Yes. InnovativeMedicalAssociates.com is the website, InnovativeMedicalAssociates.com. Also, we want you to know, before we get back into the program, if you hear some of the show or maybe you missed some, you want to hear it again, we have the Health Watch replay every Sunday, 4 till 5. It's the show you're hearing now. We replay it 4 to 5 every Sunday right here on Talk Radio 1210 WPHT. Right now in the studio, if you have a question for Dr. Molly, we have some open lines, 855-839-1210. 855-839-1210. Always like to hear about new patients, Dr. Molly. We have a couple?
Yeah, I do. I have a very nice young man who just started with me, I think, on Tuesday. Real sweet kid. And it's interesting. I want to send a shout out to his granddad, who I know listens to us week to week. And he encouraged his daughter to bring him to us. They did the free consult. And I'll tell you, the minute I saw this young man and went through whatever records I could, I saw that he really doesn't have a diagnosis per se. They think it's all kinds of things, but nobody can really pinpoint it. But I will tell you, John, it goes back to autoimmune, and it reminds me so much of my early case of Michael. And
Yes.
if people got my book, they know that.
Yeah, I was thinking
Young
about that.
guy, and he's going to the best. By the way, he's going to the best doctor out there. I think he's a wonderful physician. And I told his mother that. I said, you went to the best physician out there, and if he's still holding him in his arms for some treatment, I agree with that. But I do believe we can help this young man with a certain type of hydration treatments, some nutraceuticals. Can you believe this poor kid is totally undernourished? He can't eat. He's got
I think
pain.
I saw him the other day.
Yeah, real
he,
nice
I mean,
kid.
he was like a rail.
You
That's how
know,
thin he was.
I think he has an autoimmune disorder, maybe Crohn's, maybe a subset of Crohn's or irritable bowel. It's a subset. So he doesn't test positive in any of the traditional testing, but he definitely has what? An inflammation problem in the GI tract, which makes it impossible for him to orally or eat his nutrition. So, of course, we've got to augment that in terms of the hydration. But in addition to this, we're using a subclinical dose of a traditional med that isn't used for GI problems at all. And he started his first dose. He called yesterday. His mom called for him yesterday, Saturday. I take the call, calls the answering service. They paged me right away, and I spoke to the mother. They just patched it through. Spoke to the mom, and I said, you know, this particular pharmaceutical we use in a subclinical dose, which means less than, and also we use it in a different form than it traditionally comes in. I told them to back it down. He can't take the big guns yet, even in a subclinical dose. So you get what I'm saying? It's a smaller dose than they would give anybody, and he still couldn't take it. So it gave me the test that I needed. We backed down his medication. I changed the times he's taking it, and I'm hoping to hear back from him on Monday. So these are the kind of cases that come in. I don't want this young man to lose hope, because if he gives me the time I need, we're going to help straighten him out. I don't think we can make him 100%, but we sure are going to improve his quality of life.
So he has some real difficult challenges.
Absolutely. He's undernourished, I know. He's malnourished. You know, and I really believe that just getting the proper amount of the nutraceutical, meaning some very, very important vitamins like B's, like a certain B complex, etc., are going to change what's going on. Because believe it or not, he had multiple concussions as a younger guy, and people don't realize they call the gut the little brain, because the things in the gut, the receptors in the gut are the same as the receptors. They're very parallel to what's in our brain. Isn't that interesting?
Well, how much have we heard in recent years about concussions and how
they're bad.
The long-term effects?
Right. And in this case, he's manifesting. He's had the headaches, but he's manifesting this now in the GI. And again, the receptors are very similar. That's why they call it the little brain. So I want to say that we're taking a whole different approach, and our whole objective is to improve his quality of life. Can we change post-concussion? Probably not. You know, we're not saying, and we don't really have a definitive diagnosis, but I'm sure I can get this kid back on a road of quality of life.
And you're right. For those who may not know or may not have read your book, the case of Michael many years ago.
Yeah.
This rings very similar to that.
Very similar. Only that Michael didn't have the concussion portion of this. But this young man's a great kid. His mom, I really respect them for what they're doing, because they went everywhere for him.
So at this point, do you figure that he's going to be with you for quite some time? Or
I don't know
how does that work?
I don't know how long he's going to be with me, but what I would say is he's a prime example of desperation medicine. You've gone through everything. We don't have a definitive diagnosis, but we know something is wrong. So do we change the focus from the diagnosis to, we don't put him at risk, but we start thinking about his quality of life, and that's what we're doing.
And that's really your goal with every patient.
Absolutely. Quality of life is the key.
And whether it's the cancer support or anything else.
All the autoimmune. When you have an autoimmune disease, you and I both know, and we look at here's the interesting thing. We look at a lot of conditions as autoimmune in nature. In other words, the body has some type of dysregulation, and that's what causes the disease process.
And so, again, back to this issue, and I guess trying to wrap my head around it so that people can wrap their head around it.
Sure.
So this is probably a long-term thing.
I don't necessarily want to go steady with him as much as I'm doing right now, but I see that it will be something in the future where he'll come in maybe every month. Remember, he's young. If we can get him back to homeostasis, we got it covered.
Is that on his side, being young?
Yes. But he's had this for a very, very long time, even though he has youth on his side.
How long has he had it?
Since he was a kid, and he's a grown man at this point. He's 19. So that's I mean, he
quite
had these concussions in his junior high. So it's going to take a little while, but it isn't impossible.
With the hydration and with the protocols that you've developed, do you find do you change the protocols along the way?
Sure.
Do you say, well, that worked a little better? Okay.
Sure, because listen, the beauty, well, first of all, everyone knows that medicine is science, but there's also an art to medicine. And I'm lucky enough, first of all, to have great medical people with me. And so, when we look at something, we're looking at the data, but we also look at the qualitative data. So if a patient didn't feel quite right on that dose, we're going to change it, and we're going to change it rapidly, if possible.
And you've done that.
Yeah, exactly.
And I know when I look at my bag every week.
Yeah, it's always different.
It's always a little different
John,
color.
you have so many problems. No, come on. You have so many challenges. The idea is we got to keep you around for a long time because you've been my host for many years.
Right.
And you've actually had the experience, which makes it so much better because you really have had the experience. When people talk to you, they know it isn't that you're just talking here because I'm your client. It's because you've been a client of mine.
That's
for a long
right.
time.
So I live it every week.
You bet. I remember when you weren't so good in the very beginning. So I remember coming to the hospital. I remember going to the emergency room.
That's
with
right.
you.
I remember
so
that. Yeah.
Let me tell you, this is the other thing. I think when people really come over and become patients of our facility and our doctors, what happens is I try to take an active role in being their advocate.
And you have.
Because I believe today, particularly today in the climate we have today with the virus and all of that, you really need an advocate.
And I remember one time I was getting a test, and there was a little bit of a scare, which turned out to be nothing. But you came over, and the nurse at the hospital said, your doctor comes with you for a test?
Yeah. I wanted to make sure that, we got the information that day.
I guess people aren't used to that, but that's the way you operate.
I'm your patient advocate. I'm not a physician. I'm a PH.D. You say it every day. PH.D. biochemist by trade.
Right.
And I want to say, though, I do believe in the science of medicine. It's real.
We are coming up on another break, and if you have a question for Dr. Molly, this is a good time to call because we don't like not being able to take calls. And usually on the show at the end, we have a couple that we can't get to. So call early so you're sure of getting in. 855-839-1210 is our number, 855-839-1210. That's our number here. And our show is called Health Watch, and we're here every Sunday, 8 till 9 on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor and executive director and founder of Innovative Medical Associates of Marlton, New Jersey. Again, 855-839-1210 is the number, and I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. As always, operators standing by right now. If you'd like more information, and maybe you're a bit bashful to come on the radio, you can call the operators. 856-489-0505 is the number. Remember, if you call, you can get more information, and you want to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary. 856-489-0505 is the number. And we always tell you that after we leave you at around 9 o'clock or so this morning, they'll still be there. And they're there pretty much all day. And you can call during the week as well. 856-489-0505. Innovative Medical Associates in Marlton, New Jersey. And remember, our website is now up, finally. I mean, our New Year's resolution finally came through. InnovativeMedicalAssociates.com, InnovativeMedicalAssociates.com, and we'll be adding more things in the coming weeks and months. Okay? Let's go to the phones right now here on Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. We have Jonathan in Overbrook Farms. Jonathan, good morning. You're on with Dr. Molly.
Hi, Jonathan.
Yeah. Good morning, Dr. Molly. Interesting. I always love your shows.
Oh, you're very kind. Thank you.
I had a friend who had just a terrible stomach situation,
Okay.
and he had had dengue fever, was coughing so
wow.
much.
Wow.
His stomach just went terrible. He went to a gastroenterologist, old time guy.
Sure.
He says, "I've never seen a stomach that bad." He says,
Oh, my God.
he was like a 55-year-old guy. He says, "You have the stomach of like a 95-year-old man. It's terrible."
Oh my goodness. Oh my goodness.
So I had heard that raw cabbage juice was good, and I knew
Okay.
some other things. So I said,
Right.
okay, let me make you raw cabbage juice, raw carrot juice, and with some barley grass juice powder.
Okay.
Okay.
Sounds good
And I
so
gave-
far.
Yeah,
Sounds good.
raw cabbage juice, one of the best. So I had him start to take that like a glass or two a day.
Okay.
And within 2 weeks, his 2 weeks or a week, his hiatal hernia, his stomach dropped back down,
Great.
and then within a month, he was eating hot peppers just to
Okay.
prove he could do it.
Well, I'll tell you what, that's great. If he was getting the anti-inflammatory properties of the hot
So,
peppers. Yeah. Okay.
Maybe for this young man, like what if it were me, I would say, okay, make that concoction and
Sure.
just take like a teaspoon every 3 hours.
I think that's a great
And then-
idea.
And then after a day or two, a tablespoon every 3 hours.
That's
and then
right.
see if
That's
he can
the way
work
to
up.
do it. You know what's interesting, Jonathan? I like your approach because you don't hit him over the head right to begin with and do this. The only thing I would say in addition to that, I probably would put your particular friend, although thank God he's okay now, I would probably put him on some probiotics as well, and I would probably look at maybe some super enzymes. And there's great products out there. Listen, if you're a listener, then you hear the show ahead of me. So I'm going to say they have great products, but there are other ones too you can get in the vitamin shop. And my nurse Barbara would be happily tell you what you should add to that. Okay.
Mm-hmm. Yeah, great.
Okay.
Thank you.
Thank you.
Okay,
Thanks
very
for the
good.
call.
Jonathan, thanks a lot.
Nice
Appreciate
call.
it.
Nice
Appreciate
call.
it.
Yeah. And it brings me to something, John, that I want to say. Obviously, as I always say, the hydration isn't holy water. You want to do some other things with the natural substances. And again, I'm going to say, if you need to use some pharmaceuticals, we have no opposition to that. What we want to do is use the least amount. But I will tell you, you can't just take the hydration and say, oh, my worries are over. I have that problem with a lot of my cardiac patients, the hyperlipidemic patients who have high cholesterol, high triglycerides, high hemoglobin A1C, which means they're out of control in their diabetes, which you know a lot about.
Yes.
Okay. What do we need to do? We need to counsel them on their diets, as well as giving them orals that we believe will augment what we do with the hydration. So, I mean, this was a good call. So it really tells me, although I won't tell him what I put this young man on yet, but I think that Jonathan was on the right track.
We should bring up the fact that, and you mentioned your nurse Barbara, who's very good at
She is.
very good at telling you what to take with a particular challenge that you may have.
right.
In fact, she goes so far as to tell you what aisle it's in the store.
Yeah,
I mean,
we don't want to say that we only use one store, but
Right.
I mean, she knows what aisle it is in the store closest to us. Let's put
Right,
it that way.
exactly.
But I will say that she really understands the brands. And the thing that I find interesting is I believe how we utilize the orals in synergistically with the hydration. That, I believe, is the difference between us. And by the way, we don't sell.
I know you don't.
We're not going to bombard you. I mean, we may sell an occasional vitamin or two because we need to, but we don't sell them. You know, that's not our forte.
yeah, and I want to also mention, you mentioned probiotics.
Yeah.
You hear a lot about that today. Is there anything to that?
Of course, I think it's very important. Dr. Molly herself takes two different types, actually. I take a probiotic that I use for my GI tract, and I take a particular probiotic that I actually have you on for your kidney health.
Yes.
And again, I use that a lot for my people who have bladder cancer, kidney cancer, along with our hydration protocol. So yeah, I believe in them. I think good bacteria is extremely important, and you need a very good brand. I also believe in the super enzymes because I think I did a lot of work, and there's a lot of controversy about some of the cancer physicians from the early days. Many of them believed that enzymatically people were depleted, and they actually did the tests to show that their pancreatic enzymes were very low. And so they may need to augment with some enzymes in addition to just taking a couple at their meals.
You have mentioned often here on the show, and it's worth mentioning again, just don't go into the health food store without getting advice.
Please don't, especially today. Please don't. You know how many? I actually had a friend of mine, I told you, who's a very wonderful nutritionist. She tells me that people are not asking her about what to take for antiviral in nature. And by the way, there's a lot of natural substances that have an antiviral property, but I'm not sure they're going to cure corona.
Right.
In fact, I won't say they will.
No.
But the point is, she was saying, people were calling her up and say, give me the cure for corona. Well, if she could do that, she'd be a wealthy woman.
That's right. That's right. But it's important to get advice, because if you just walk into a health food store,
absolutely.
I mean, it's overwhelming.
It is.
They must have tens of thousands of products.
And
in
you
there.
know what's happening? It's getting worse, John, because a lot of the brands, the good brands that we knew 20 years ago, have been bought out by larger companies that have a stake in prepared foods, and there's a lot going on in the industry.
So just try to get some advice,
exactly,
and from someone who knows, like
right?
yourself.
And we give out plenty of advice if you're an enrolled patient,
right? How many times have you gotten people with bags coming in?
Oh my goodness, too numerous to count, as they say in my vernacular. And we've seen plenty over the years. Plenty.
And 10 things do the same thing that one does.
Or interferes with everything else you're doing.
Exactly.
So I mean, it's really, really important that you do this correctly. I mean, let your food be your medicine, and I want you to remember that food and food extracts are medicine.
Okay, I know we have another patient we want to talk about. We're coming up on a break, so we'll do that after the break.
Great.
Dr. Molly Fantasia is here. The show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number, and you still have some time to get in here with a question or a thought if you'd like. 855-839-1210. Again, the show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More Health Watch after these words. And we are back here on Health Watch. You want to get in touch with Dr. Molly during the week, or you want to do it right now, operators are standing by. 856-489-0505. A lot of times you have many questions, but the best thing you can do is make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and she has sat down, especially this last week, with a lot of folks who listen to the show. 856-489-0505 is the number. 856-489-0505. Operators will be there well after we leave you at 9 this morning, and that's the number you can call during the week as well. And don't forget our website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And also, one more thing, if you missed some of the show now, you can catch the replay, Health Watch replay, every Sunday, 4 to 5, here on Talk Radio 1210 WPHT. Health Watch is our show, and we're going to go to the phones. We got Carl in Northern Liberties. Carl, good morning. You're on with Dr. Molly.
Good morning, Carl.
Yeah. Hi. Good morning, Dr. Molly.
Nice to talk to you again. How are you doing?
Hi. So far, so good. I'm happy to say.
Thank God.
I'm just wondering, with this virus situation we have going on, are there any particular supplements or whatever you might recommend that we take to maybe avoid getting this stuff?
Well,
or anything you think we should take if we do get it?
Listen, first of all, if you do get it, you better quarantine if you're not having symptoms, okay? Secondly, I want you to realize you've got to do all of the traditional things that are necessary. And if you have a proactive physician, I'm sure he'll put together a regimen with one of the two drugs that we know that are having some success. Now, they're not, FDA approved for this, but there are some drugs, including the malaria drug, as you know, but you got to be careful with that one because it's a fluoroquinoline and you can get some side effects to that. But if you have your doctor, if your physician prescribes it for you, he thinks it's worth the risk. In everything, Carl, you got to look at risk versus reward. Now, as far as supplements are concerned, I would want you to continue to take some good doses of vitamin C. Okay, you know that. High dose vitamin C. I would want you to possibly do, in addition to that, I would want you to do maybe melanorin, which you can get at the health food store. You can also get some lysine. There are olive leaf extract. There are many extractions that have antiviral properties, but I am not saying that'll cure the virus, but it may help your immune system. I'm on a regimen right now of high dose vitamin C. I'm on a regimen of beta glucan, which we use for autoimmune and making sure that, our immune system comes back. I take magnesium. In addition, there's some data to say that zinc may help in this arena. So there's a couple of things, and there are many more, but I really think it's important that we don't, close our eyes to this and think it's all going to be cured by natural substances. I do think natural products can help our immune system stay strong and help us fight this thing. But I think we better all pay attention to the science and really look at, following the quarantine orders. And again, did you get tested by any chance, Carl?
No, I haven't been tested, haven't had any symptoms.
Thank God. Okay, good. It
and
tells
I am,
me...
indeed, self-quarantining.
Good.
Isolating.
Good.
Isolating. But
Yeah.
I'm wondering, what would you say high dose of vitamin C and the magnesium and zinc? How much is
Well,
good?
I tell you, for me, I orally take maybe 5,000 to 7,000. That's what I take orally, but I also take a high dose vitamin C IV, which is probably in the range of 100 grams. So we can't compare that. But I would definitely start taking some vitamin C. The zinc, I would probably use zinc glutamate, and I would follow the directions on the bottle from the manufacturer you get. And that's about all I can say right now, Carl, unless you call the office. But seriously, you're doing all the right things, and God bless you in this journey, and God bless everybody in this journey.
Okay, Carl?
Thank you.
Thank you very much.
Thanks
God
a lot
bless
for the
you.
call.
Thank
Appreciate it. It goes without saying, well, for those who may have been listening for the first time, you have said many times that you can't get in a bottle what you get in the hydration.
No, and also the extract I use. Again, we're using whole food extracts. So it makes a huge difference. That includes all of our IV nutraceuticals. So, it is very important, though. It's very important that people don't fall for this thing that, if you're around someone that has it, you can't get it. No, you can't. You may not get it if your immune system is strong enough to keep you from getting it. But otherwise, I think we have to be judicious in how we do this. I mean, no one wants this to be ending more than I, because I have patients who are a little elderly and their children won't allow them back to me, as you know.
Yes.
And they call me and they're crying, I want to see you. I said, well, we're doing a pretty good job here, but if your son or daughter doesn't want you out, I mean, you gotta have family harmony, right? But I do check in with all my elderly patients though too.
Yeah.
So it's
real quick. We got about 2 minutes.
Sure.
You wanted to talk about a patient who has PRP.
Yeah, she had PRP, but the reason why I want to talk about her is she has comorbidities. She's a cancer survivor of breast cancer. She's been with me for quite a while, at least 4 years. She does a protocol for the cancer support. She has severe diabetes. She's had this since she was a young girl. In fact, so much so that she's wearing an insulin pump. And she wanted to do PRP, which is platelet-rich plasma for her niece. And guess what we did? We did our protocol for platelet-rich plasma, and she's doing very, very well. She said the pain has been reduced at least 60-65%, which, by the way, is a lot, John. She's able to walk on it. Like she said, it's not a miracle. I don't feel like I have a whole new joint, but I'll tell you what. She said, I'm able to do a lot more. And her physical therapist said, what did you do? She said, I went to Dr. Molly's and did her protocol for PRP, which means really my physician's protocol.
That's right. And that's a good note to put the wrap on this.
Thank you.
Okay. That's going to put the wraps on another edition of Health Watch. And don't forget, if you'd like to reach Dr. Molly, 856-489-0505 is the number. You can call after we leave you this morning, or you can call anytime during the week, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, the show is replayed this afternoon, 4 to 5. If you missed any of it, you could hear it 4 to 5 this afternoon here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Dee, our nurses, Jess, Michelle, Crystal, and our nursing associate, Kathy, and, of course, all of our fine physicians, I'm your host, John DeMasi. Have yourself a great week. Stay safe. Stay healthy. We'll do it all over again next Sunday, 8 till 9,